Hello, everybody. Today we have Dr. Laurel Mellon, and who is the founder of Emotional Brain Training, a neuroscience-based solution to stress. And stress seems to be the operative word for all of us right about now, no matter if you're an employer, an employee, no matter what your job is. Stress is what we're all under. So we're all in the same boat, and Dr. Mellon's going to help us to figure out how to go ahead and handle that the best way. She's a health psychologist, and she is an associate clinical professor of family and community medicine and pediatric school of medicine, University of California in San Francisco. Beautiful, beautiful town, as we all know. And so I'm going to turn it over to her in just a minute, but I also want you to know that she's also an author, which I thought she was just an author of one book, but holy smokes, I found out numerous books, which I'm sure she'll tell us a little bit more about. So would like to welcome you, Dr. Mellon. And now that we all know that you're going to help us with stress, we're all ears. So I'm going to turn it over to you.
Well, thank you so much. What a wonderful opportunity. And I've really enjoyed working with your organization. And right now, it's a time of a lot of contemplation among many of us, because it's very, very hard to deal with the overwhelming stress that we're under. And so one of the great things about things being way too much and overwhelming is we get creative, we look to science, and we see if we can make a reset in how we approach something. And that's just exactly what we're doing with emotional brain training. Here's a little bit about my background, but the idea is that I've been studying the emotional brain for 40 years. And the reason I started studying it is because I wanted to find how to get to the root cause of all these stress-related diseases we have. When you're looking at it, whether it's addictions or obesity or diabetes or getting triggered or relationship problems or anxiety, depression, what the science is showing us, it's all about stress. And so why not go to the stress brain? And that's the emotional brain. And many years ago, we didn't think that our unconscious mind right here was between our ears was actually something that we could change. And because we've approached it from a neurophysiology, neuroplasticity basis, based on the latest science, we found a way to make it easy for people to take charge of the wires and the chemicals in their emotional brain and switch off stress in record time, 2 to 4 minutes, and also activate states of well-being. So right now, we're seeing a world in which when COVID entered the scene, we ended up finding that essentially it's too much, that people are just too stressed. We know that's really, really a problem on many fronts. And the fact is, a very simple shift in our paradigm, instead of treating all of these symptoms of stress as if they were separate silos, to go to the root cause of what makes all of them more challenging and deal with the stress inside our bodies, our physiological stress, it ends up being something that changes healthcare. Because most problems are due to stress, if you as an individual, your employees actually know how to switch off stress and do it throughout the day, we're going to see a big difference. For example, look at this man. He's obviously quite upset. That same man, if he was able to just reach for some tools and switch off the stress in his brain, he would be speaking in really connected ways to his customers. Same for this woman who's at home with, shelter in place right now. But the stress just gets overloaded in her brain. And what happens? It goes to anxiety, depression. And what happens is you really think when you're in these states that you're doomed. You're gonna always feel this bad. There must be something really wrong with you. And you don't know how to shut that off. But if you actually reach for these tools and switch it off, this woman that you see here looking so upset and disconnected from her kids would actually look happy. She might stand up and go over and sing and dance with them. We're that different when we're not in stress. We're completely different people, and that's true for everyone. And what about this woman? This woman is discouraged and upset. She's just been nursed, probably seen someone pass away or someone that she really wants to help and can't. If her brain gets stuck in stress, That's the root cause of our chronic diseases, such as diabetes, obesity, cancer, heart disease, and she's at risk for one thing. She does not know how. She does not have the tools to switch off that stress. And quite frankly, this science is new. I'll tell you about that in a minute. But right now, stress is such an important thing and a determinant of whether we bring our best selves to recovering from COVID-19. So we know that we were already stressed out. This COVID-19 took us on a tailspin. And the stress that we feel inside, we're talking about not external stress, but external stress goes into our brain. Our brain's the filter. And if the brain doesn't filter out that stress, it goes right into our bodies and cause comorbidities that increase the severity of COVID-19. It also suppresses our immune system. A lot of people can be out socializing and doing different things and not get infected. But if your immune system is compromised because you're stressed out, you're going to be more susceptible. And one other thing I want is really important for you to know that essentially in 1988, it was discovered that there was a two-way street between the brain and the body. So right now in medicine, people will say, well, they have a physical problem, or they have a metabolic problem, or they have a psychological problem. Actually, if you're in stress, you have problems in all areas. Let's say, for example, I twisted my ankle, got a physical pain. It's going to go up to my brain and create psychological stress. That psychological stress is going to feed right back to my ankle and make it hurt more. So please just update your thinking about the science. We're all one. We're all connected. And so these health problems we're having are going to cause a second pandemic of toxic stress. In fact, a study was just released that showed that 2 years ago, only 22% of people had these mental distress at a moderate to high level in the United States. Now, 70% do. So we're very affected by this COVID-19 epidemic. And it turns out that when we're in stress, that's when everything goes haywire. So the idea is that we all trust that we can cope. And the fact is, in our healthcare system, we have used cognitive methods, thinking methods, change your thoughts, be positive, analyze your patterns. It's all due to the thinking brain. But the thinking brain goes on the fritz during stress. And what happens is they've just done a recent study that showed that they couldn't figure out, these researchers at NYU said, why is it that we all use cognitive, CBT, these awareness, mindful methods? But in fact, while they're being used, the epidemics of stress-related problems have gone to amazing levels. And it's costing businesses, insurance companies a lot because we didn't deal with the stress. So they did a study and they showed that in fact, when you're in low stress, all those methods work fantastically. And as soon as you move to a higher level of stress, and this was normal stress pre-COVID-19, not what we're dealing with now, these cognitive methods failed the stress test. The emotional brain takes over. Unless you have emotional tools, you fail the stress test and you get stuck in stress overload, and that toxic stress, exactly what causes our whole society billions of dollars. So what we need is we need a way for each individual to take responsibility for their toxic stress. You can get triggered 24/7. So it's not like you go to a therapist once a week and they try to, work with you with your responses and everything. If you learn from the therapist or go to the doctor, what happens is you come out of the office and what happens, but somebody offends you or somebody yells at you or you fail at something and all of a sudden you're triggered. Individuals need to take their own emotional power to process the stress that comes in, move it through, and come back to a state of well-being. So this new stress vaccine, we're looking for a COVID vaccine, that's true. But if we want to return as a really prosperous, healthy, productive country, we're going to need two vaccines. We're going to need that COVID vaccine, and we're going to need a stress vaccine. And we don't have to look far for it because that vaccine is EBT. It conforms exactly to the emotional pathways in the brain to clear away stress. You probably hear a lot about resilience. You say, well, There's a lot that goes into resilience, yes, and that's the problem. It's so complicated. Look at all these things that are just one shot of it, but essentially people are looking at resilience as top down, in other words, thinking oriented. But the power to be resilient is in our emotional brain. Everyone has 5 different pathways to get from stress and feeling overwhelmed to feeling absolutely good or great. And when we're only thinking and trying to analyze what's wrong with us, like this, we're only using the low stress pathways, 2 of them. That means the high stress pathways are not being used, and those are the ones we really need. We can't afford to have our population, our employees, playing with 2 out of the 5 tools or the 5 pathways in the brain, because we're going to get stuck, stalled, and overloaded. Interestingly, when you go back to brain science, it keeps it so simple, and I'll show you about that in a minute. Essentially, emotional brain training is a way of just identifying your level of stress in your brain and then bringing it back, using a tool for that level of stress, getting on that resiliency pathway and coming back to a state of well-being. We actually discovered it in 2007 with my colleagues at UCSF, and then we've worked hard since then to make it really scalable, really easy, and something anyone can learn. So there are many programs on resilience, but the easy way to do it is let the emotional brain do the work. Know your stress number, get on that pathway, get back to that state of connection. And everyone starts with a mobile app just because it's fun to kind of play with it. What happens when I push this button, and can I really get from feeling hungry and miserable and grumpy to feeling good? But also people can go beyond that and actually get concierge coaching for privacy, get a 3-day intensive brain reset, whatever they want. But everyone starts with the mobile app, and it opens doors to these pathways. So what is this brain science? Well, it actually brings tears to my eyes because it's a beautiful situation that happened over a period of, 30 years, okay? So essentially, it started with a guy named Peter Sterling, who was a neuroscientist. He was kind of a hippie, and he was in Cleveland, and he saw all these people that had a lot of stress in their lives, and they had strokes and addiction and all these things. He says, I don't think that old homeostasis, that physiology I learned in high school, I think there's something going on here. So he says, I think there's an overdrive the brain goes to when it's really super toxic and super stressed out. So he not only hypothesized that, he went to his lab and he proved it, that the brain essentially has 2 separate gears. And this affects the kind of wires and the kind of chemicals that are being activated. So he says, okay, everybody, it's not just plain old homeostasis, everything staying in balance. The brain, if it can't take it anymore, which I know you probably have that feeling. I did a lot during this shelter in place time. You go into a whole nother world where there's no shut-off valves. The brain will do whatever, eat, drink, spin, high blood pressure, stomach aches. It'll just do anything, and then it gets stuck on. So he discovered stress overload. Next came Michael Merzenich, and Michael Merzenich is a great friend of mine and has been wonderful in helping EBT move forward because he's at the UCSF as well. He actually proved that, in fact, the human brain is very plastic. Well, what does the human brain do is the most important thing? It clears stress and threats and get back to a state of reward. So he proved that the brain can change. Igor Mitrovich, who I met with this morning again, he's our scientific director. He's a neurophysiologist and a neuroscientist, and he came to EBT a number of years ago because his wife says, you're stressed out. You need this thing that Dr. Mellon's doing. Why don't you go talk to Dr. Mellon? And so he did that, and he's been collaborating with our team there ever since. And he discovered, he says, look, just keep it simple. There's 2 kinds of circuits, the good guys and the bad guys, the one that get us all triggered, those stress reactive circuits in the brain. And then there's the other circuits that are stress resilient that make us feel like the nicest person on earth and get our work done and everything else. So he came up with stress circuits. At NYU, they showed that when you change circuits, essentially you can erase circuits. So you can change your brain to be more resilient and less reactive when you actually feed it an experience of of resilience. And that's just what we do in EBT. And I developed the tools to do it. But I want you to get this picture because it's a good chance you don't know this information. And I hope that everyone knows it. In fact, I hope they teach it in high school within 5 years. And that is that, let's say, here I am, I'm giving this talk. And let's say all of a sudden my dog starts whining and crying like she's being eaten by a lion or something like that. And the stimulus comes into my brain. It is going to come into my brain and either trigger a stress reactive circuit or a stress resilient circuit. If the stress reactive circuit is more dominant because maybe I had early childhood adverse circumstances or later trauma, or just the stress overload of society now can put us into a mode where we activate these circuits. And let's say that I did activate my stress reactive circuit. My emotions shut down, they get ineffective. I have absolutely unreasonable expectations, and I do something stupid like scream, shout, and yell, and run away the opposite direction, not the right direction. So in these stress reactive circuits, we get triggered all day, every day. You can be triggered, and when they happen, the thinking brain goes offline, and we repeat whatever we did before. It's very important for you to know that as much as we're thinking about the COVID virus, that in fact, when it comes to humanity, this is the mega germ. This is the root cause of human suffering. This is why medications, procedures, and devices are so expensive, because no one is rewiring or shutting off these stress reactive circuits. And so if we can get a hold of that one thing, teach our employees to actually learn how to recognize those stress states and switch off those wires, chemically, electrically, every organ in our bodies will be better off for it and will prevent problems. And if we have to take medications or whatever, they'll work much better. This is the villain. This is what we have an opportunity to change if our employees learn how to switch off these circuits. And of course, if they switch them off, another kind of circuit comes in. And this is like beautiful. This is the kind of circuit that you just stay the course. The dog's barking, and I'm sort of stay the course. I say, okay, I'm going to take a moment, really process my emotions, figure out what's going on. And at that point, I stay connected. My thinking brain stays online. I make a better choice, and then I feel great afterwards. I feel really proud of myself. This slide, I hope you remember as well. The two slides I really want you to remember is toxic stress. That's the big germ. That's the mega germ. If we crack that, it's going to change business. It's going to change employment. It's going to change our universe, really. Because when these circuits are activated, they take us to a state, a brain state, a way of being. And that affects thoughts, feelings, relationships, behaviors, physiology, everything. So you've probably had the situation where you're kind of not really triggered, you're kind of dealing with stress pretty well, and you notice that everything that could go right is going right. You see that? Everything is good, okay? If you trigger a reactive circuit, every domain of life is a problem. Now in medicine right now, we teach this to medical students at the University of California, San Francisco, and they open their eyes and say, oh my gosh, it's completely different than just medications and procedures and so forth. I said, yes, the root cause of the problem is when that brain is in stress overload. If you try to treat one problem, like let's say an addiction or let's say overeating, the behavior, the person is really experiencing problems in all those areas. So start with doing it the smart and easy way. Teach them how to get out of the stress zone. And it's remarkably easy because people now know they should check in. There's been mindfulness has been around, you check in, even, the social networking, just check in, right? Okay, so you check in, take a deep breath, but then something's very, very different. You actually ask yourself, what's my number? So these are your 5 resiliency pathways. Each one of them leads to brain state 1, which is the best for overall health, happiness, productivity, relationships, everything. Each one does. Now, the first 2 are pretty easy. Most people have those tools, like how do I feel? What do I need? That kind of thing. Unfortunately, when you're in this category, feeling low stress, those are the stress resilient circuits, what happens is you can check your feelings. You just know what you need and you're fine. From here on down, you go off a cliff. And at 3, 4, and 5, the emotions get stuck, stalled, overwhelmed, anxious, hostile, numb, and you can't do anything with them because they're stuck emotions. The thinking brain goes offline, you're not thinking well, and that's where EBT comes in. You just say, what's my number? Oh, I'm at 3. And within a couple minutes, you process your emotions. This is the emotional brain or the stress brain. And so all of these are simple, structured, emotional tools I first taught to children. Anyone can learn them, and they work very quickly to get you back to a state of connection where you can think really well. But you'll feel so good after a couple minutes that you might just say, great, I feel good. But evolutionary biology wants us to be productive, to go forward with purpose. And so you take an extra 45 seconds and you use this tool, the take action tool, so you have clarity. Okay, now that I feel so great, now I want to get stuff done. Now I want to move forward with purpose. And it guides you in your brain to feel a purpose, to get a dopamine surge so you have energy, and an endorphin glow. And all of it happens in 2 to 4 minutes. And you even score a surge of dopamine and endorphins, which we call a joy point. So that break, taking that throughout the day, keeps those stress circuits from getting stuck on. I want to share the real life of this because for me, having worked on EBT for so many years, I have endless energy for it just because people are desperate. People say nothing works. I go to 10 years of therapy. Of course, therapy can work, but taking 10 years of therapy, I go sit on a mountain and meditate. I try every medication, and medications and all these procedures are all great. But EBT is based on the brain, and it gives people control of their own brain. They can shift gears in their own brain, and it happens quickly because emotional processing is fast, whereas cognitive processing is clunky. So the idea is here's employee stress with customers. So I'm going to give you an example from my own practice in the last week. And one of the ideas here is that when people are upset, they start blaming themselves. They assume that it's all their fault. They are the only person who's mixed up. Everybody else has it together. And that's just actually normal in the brain. So here's I think I may have missed a slide. Communication, okay. Here's with stressed customers. The idea is when you have a stressed customer, you know that you are having a hard time of it. And so I have an example of a woman who came to me and she said, oh my gosh, I keep talking to people, they don't listen to me, and I'm so frustrated because I have so many nasty, stressed out customers. And her name was Susan, and she was actually working in an office where she was dealing with insurance claims. And she said, this is the most stressful job I've ever had. I can't stand these abusive customers anymore. And so she came to EBT. I said, look, take the mobile app. You can do more work later if you want. Take the mobile app, and every time you don't feel good, take it seriously because you have cortisol and stress hormones coursing through your body, and that's going to make you sick and tired, and you're getting burned out. And so she says, okay. So she came back and she says to me, she says, Dr. Laurel, I don't know what's going on, but I only did it 4 times during the day. But just the power of being able to understand that I have control over how I feel inside, and I don't have to wait until I get home at night to do something about it, it makes all the difference. So when it comes to stressed customers, the idea is the employee needs to stay with the corporate policies, but without compromising their health and burning themselves out. That's the challenge. So the idea is that everyone should be able to check in and monitor their number. If they get to 5 where they're really disconnected, at that level, ask for support. You're not wrong or bad. At 5, you're overloaded and you need to reach outside of yourself in order to begin to calm that amygdala, the stress center, and calm down a little bit. So don't judge yourself when you're at 5, but if you're at 4, 3, or 2, it's going to be easier to spiral up. And afterwards, use the app and get some relief. Then you're going to be able to clear that stress. And then you'll be able to get to a point where you say, well, I'm going to learn something from that experience. I'm going to share it with my team so my company can get stronger. The next one is essentially employee stress with coworkers. This is really a big piece of the stress at work, because what happens, I'm a psychologist, I'm a health psychologist, but what happens is people have their past, from past relationships, from past work situations, even from childhood, come up at work. So their boss starts to look very threatening, or their coworker they get into conflict with. So an example that came up recently in coaching was a woman named Meredith. She lived in Texas, and she was a project manager for a large corporation. And she was, again, very close to burnout. She wasn't showing up at work because she had been moved from one department to the other, and she loved her other team. This new team did not like her at all. And what happened is she was so used to being really admired and loved by her team that when she came to really abrasive people who wanted to do everything to sabotage her, she went right to 5. And so what she did is she began using the app. She did a couple of concierge coaching sessions, and she really solved it. She says, I learned that when I'm at 4 or 5, I want to get my love and acceptance and validation from my teammates. And in truth, it's my job. Once I got to Brain State 1, it's my job to do really hard things and do it for integrity. And even though I'm not getting that appreciation, get the job done in a way that I feel good about. And she started to bond with her teammates, and she began to stay with her job and even like it. So these little tips of switching up the brain make a big difference. So employees should know that they will get activated at work. That's just how the brain works. That's the emotional brain. But if they check in throughout the day and monitor their number, if they're at 5 and they're about to blame someone or get aggressive or shut down or be passive aggressive, all the things that, happen every day at work, say to yourself, I'm at 5. I think I'm really more stressed than I know. They switch up their brain state. They get back into that state of connection and well-being. Think of all those great attributes at 1 and 2. They become that person again. And then they say to themselves, the stress at work is good for me. I want you to really hear what I'm saying right now. Stress, if you're stressed in a moment, stay with it for a little bit and then spiral up. The brain actually updates its resilience. It strengthens those resiliency pathways. It is actually good for you. It's bad for you when you get stuck in that stress, don't have the tools, even though they're available, don't have the tools to snap out of it. And that's when the problems arise. So it goes from being good for you if you can dip down and snap out of it, boost yourself up, and very, very toxic if not. It's a big difference. What about employee stress with sick patients? That's a big issue right now with COVID. And I've had so many people in our intensives and using the app and in our coaching. This is the issue, is that, I'll go back to this slide. Here we go. I want to tell you 2 stories because they're very poignant and they just happened. And one of them is a woman named Janet who was in critical care. And she called me a couple of weeks ago and she just said, everyone on the floor is at 5, brain state 5. That's toxic stress overload, stuck, stalled, overwhelmed, numb, confused, not thinking well. And I'm at 5 and I don't know what to do. I can't take it anymore. I said, well, just see, why don't you try the app? And if you want to do more, you tell me, but give me a call in a couple of weeks after you give it a go. So she calls me up and she says, Laurel, I used the app. I spiraled up through my emotional pathways and I'm at 2, even though they're at 5. This has been life-changing for me. And I know what she's going through. So I really appreciated when she said that, because that's the power of using the emotional pathways in the brain. They're there for us. We just need to use them. Another one is equally challenging, which is, this is a pediatrician named Elizabeth. And what happened for her is, with all this COVID, the children were so sick and there was so much stress in parents that she was just overwhelmed. And what she did is she brought her app to work and she just kept it on her desk. So she was using the app and the pediatrician from the next office came over and said, what are you doing? And she says, oh, I just do EBT. I just spiral it up. And she says, well, can I do it with you? And she says, okay. So the 2 of them use the app together. And the woman says, why doesn't every doctor and every nurse have this? And so the idea is, this is all new. It's only been around since 2007. But it's with COVID that people say, stop, wait, we've got to do something differently. We've got to reboot how we process stress. So what is the challenge for employee stress with sick patients. They have to understand that their emotional brain has no wall. That means that the patient's stress comes into their brain, and then they logically think they should be okay, but they're not going to be okay. They've got to clear that stress out. It's like stress clutter or emotional trash. They've got to clear it out or it's going to pile up. So again, check in and monitor your number. Don't judge yourself. Physicians and nurses tend to really judge themselves when they don't feel like they're kind or nice or can't do everything for everyone. It's absolutely normal to be in all 5 brain states and to bring up a kind voice and say, well, I'm at 5. I can do something about that. I can spiral up, but to not have judgment. The brain can't stand judgment. And so also to use the tools so that each time you do, you first process the stress, and then you move back to that take action tool. So you end up being aware of your higher purpose in life for doing your work. And that goes for all of us. We bring to mind the higher purpose, and that's part of the EBT experience. And so we get a shot of dopamine and endorphins from that. And also, employees tend to get together. They have a little support from their colleagues in order to actually use the tools together. They do that at UCSF. The residents will use the tools together. It just adds another layer of support. But you can also do it just quietly inside, and that's the way most people do it most of the time. So what about employee stress and family stress? It's just been so hard with everybody having there's lots of competing priorities. And so what is an employee's responsibility when it comes to family? Essentially, they've got to keep themselves happy and healthy enough so they can make those hard decisions about balancing competing priorities. Again, this is a method that is used for all people. The emotional brain is the same regardless of your age, starting at about 10 or 12 all the way up to 95-year-olds. My mother used it before she died because she didn't want to take sleeping pills, and she did use the tools instead, and it put her to sleep, made her relax. But be aware of not only your own brain state if you're a parent, but be aware of the brain state of your spouse and children or partner, and appreciate that when a person's in a particular state, it feels like they're a different person. And they are. At 5, everybody's nasty, everybody's shut down, everyone's difficult to be with, and everyone at 1 is just full of love and light. So know that if you check what your spouse's brain state is, let's say, oh, like last night I was at 4 and I was kind of crabby. And I said to Walt, I said, my partner, my husband, I said, I'm at 4. And he says, oh yeah, I'm sorry you're at 4. Yeah, I'm running about 5 myself right now. And we smiled at each other. So there's no judgments. It's all science-based. It's all really simple, and it really works. So you can use the tools with family members and have this be part of your language around the house to be stress effective. So what does that mean? It means that we do need a COVID-19 vaccine. But for us to truly recover and regain our prominence in terms of productivity, in terms of prosperity, health, happiness, and meaning in life, we need to go to the bottom of our brain, to that emotional brain, and learn how to process the stress at all 5 levels. We've got to play with the full deck. We've got to have all 5 resiliency pathways available to everyone. So again, it's fast, 2 to 4 minutes. No one knows you're using it. It's all in your head, right? It just works. You just say the different prompts and it's in your head, and you all of a sudden, instead of feeling irritated with your customer, you kind of like that customer. It also, because it's so quick, it avoids what we simply don't want, is suppressing emotions and getting so pent up with reactivity that when we go home, we have a meltdown or we have an upset or even one at work. So this whole idea of waiting until after work to release stress, that just can't happen. We need to release it throughout the day, and we can do it in a couple minutes. And lastly, that every time we use those tools, just imagine the brain's resiliency circuits get stronger and stronger and stronger, and those reactive circuits, they get weaker and weaker until we raise our brain's emotional set point, and we naturally stay in a state of connection more of the time. And that's the point for health outcomes, for productivity, for happiness and purpose. So how do you get to use this in your corporate environment? You really start very simply. People just need a little book on EBT, and they need the app, and they can begin to experiment with it. And what this is doing is our mission at EBT is essentially brain-based health. We want our health system to shift so that we use the power of the brain to clear away stress, to improve our chemicals and electricity in our body naturally, use what we've got, the emotional brain. And if we can do that, we make that one shift so that as a country, we move to the EBT 5-point system and start being stress effective, we can reboot our workforce to be happier, healthier, and more productive. Thank you very much for listening to this presentation.